I'm often asked what we can and can't treat using our tools here at the Rose Method. The first thing to be clear about is what it is that we do. You see, our tools offer a simple way of permanently changing your emotional state, which means if you tell me, look, in this situation I feel this, I can work with you to change it. So the next time you're in that situation, you feel something different. So suppose you come to me with an emotional problem, which could be, in my relationship, this is what's going on at work, this is what's going on. It's actually very easy to help you because we just need to identify what you're feeling in that situation and change it. So with any kind of emotional problem, which includes sort of relationship dynamics, any sort of interpersonal dynamics, business type situations, or even athleticism, anything where your mental or emotional state is what's driving your outcome, I'm able to help you. I'm able to help you quite easily. The interesting question comes when we talk about physical symptoms, and of course I'm asked about this a lot, and the answer is, look, if your physical symptoms, if your physical state is being affected by your emotions, then I can help. And it often is the case, but just not always. So very often a person has pain, tension, discomfort, or even disease in their body because of suppressed emotions. And if that's the case, what I do is I help you to identify those emotions and we change it. And when we change the emotions, your body changes. So yes, I can help with a lot of physical problems. However, I can't tell you that every single physical problem is caused by emotions. It's simply not the case. And it's not possible to give you a list of which ones are and which ones aren't, because it is quite individual. And really, if you're primarily looking for help on a physical level rather than emotional, the best thing to do would be to choose a therapist and write to them and say, look, here are my symptoms, what do you think? In your experience, is this kind of thing emotional? Is this something you've had success with before? And we will always give you our most honest and realistic answer before booking a session with you. The other question, which is really interesting, is about who we can and who we can't help. Now there are different layers to this, but the general thing you need to know is the RPT and Rose Method processes do require you to be able to feel feelings, which means to have some awareness of what's happening in your body, changes in your body, to be able to say, well, when I'm here, I feel this, when I'm there, I feel that. If that's you, if you can name an emotion, if you can feel feeling quite easily, you're going to find that the processes that we do very, very easy. But what if you're someone that has trouble with that? Well, look, a lot of people have trouble feeling their feelings, or when they get stressed or scared, they shut down their feelings as a kind of a survival response. That's usually a response to trauma. It's something that's learnt in your childhood. I can help you with that if you're really ready and willing to do that. So suppose you came to me with a problem, let's call it a relationship problem. Before I can really work with you on the relationship problem, we might need to do a couple of sessions about reconnecting with your feelings. That's simply the priority issue. And provided you're really willing and ready to work on that you want to feel your feelings again, I can help you with it. There are, however, people I can't help. A couple of examples of that would be people who are on antidepressants and people who have some kind of psychiatric issue. The thing about antidepressants is it makes it very hard to feel your feelings. And I certainly don't recommend that you suddenly come off any medication in order to do the process, because that should only be done under a doctor's supervision. In relation to psychiatric conditions such as a personality disorder, again, that's really something that you need specialist help with that goes outside the scope of what we do at Rose Method. So as a general advice, people within the average or normal spectrum, people who are not currently taking psychiatric medications or having a psychiatric condition, those are the people we can absolutely help. And the more easy it is for you to feel your feelings, the easier it is for us to give you really great results.